I want to start by saying thank you to all of you for what you do. You know, just even personally, the clients that we work with are an extremely challenging group. A lot of people don't care to work with this group. You're talking about people who have severe criminal histories, addiction histories, and most of the time, mental health issues. And that makes them very challenging to work with. So I want to thank you for the work that you guys do to support them, because you know, and I think I probably can thank you on the behalf of the clients. You probably don't get to hear as much, and I wish that they would hopefully tell you as much as they appreciate it, but I do get to hear a lot of positive things from them about ways that you've helped them in little bits here and there. A lot of them are often surprised by, sometimes they kind of question that, and you know, who are these people that come to drug court that don't know any of us? Why are they just sitting back there in the audience? Like, why do they care to come watch us? Like, that's really weird. That's kind of how a lot of them feel. And, you know, they start to learn over time, thankfully, a lot of times due to what you guys have to trust people. And I think that's one of the important things for you guys to understand, is that many of the people you're dealing with have severe trust issues, whether it's because they have encountered a lot of abuse in their lives, which is true for most of them. Some form of emotional, sexual, physical abuse is very common at some point in their lives, whether they'll be open with you about it or not. Whether it's because of just strained relationships, if it's because of their life on the streets, trust isn't something that's given very freely. So for you, being, you know, some stranger in their eyes, just wanting to help them is a very foreign concept. So as far as one of the challenges that you face, keep that in mind. There may be times where you try to help people and you're gonna get two very different responses. Some people have been taught to take advantage of anything that's out there, and that's the way that they were raised. Other people you're gonna see are gonna be the complete opposite, and you may offer them help and they won't take it. They might have been living on the street since they were 14 years old, and they believe in their lifestyle that if you offer help, you want something in return from them. And so they're gonna have a hard time accepting that help. And so the challenge for you is to kind of keep those kind of things in mind. You'll hear as I'm kind of talking throughout, you know, I'm not just gonna give you a succinct list of how do you deal well with working with these people, but I'm kind of gonna intertwine that as we're talking. The other thing I do want to thank you for is the support of Catholic Charities to keep the drug court program going. Now, this has been some time since that's happened, but for us as an agency, and I think as a program, we truly appreciate that. The fact, and honestly, I guess I haven't had time to research it, but I would guess that it is probably not something that has happened if we looked over across the country, or in very few instances, that an independent organization has put the work in to raise the money in order to support the treatment portion to keep programming going. Of course, every year that's always a thing. And the other thing that you guys can do too is, those of you that are involved, politically, keep encouraging your legislature to, support programs like drug court, to support treatment in general, even just the criminal justice system in general. I know this year that's another big concern as far as even judicial budgets and things like that. Substance abuse, we're doing okay lately, thankfully, but some of the other areas with criminal justice is another struggle that they always face. And so it's one thing that you guys can do to help support it too, is for those of you that are politically involved, contact your legislators, keep encouraging them to support any types of programming that will help the people that you're working with. So overall, thank you guys for what you do, because you're just doing this out of the kindness of your heart. You're not getting anything besides the intrinsic returns that you get from that. It's awesome for me to hear what you guys are taking from that and getting to hear those little bits, because to be honest, it inspires me to continue. Everything that I'm talking about with you guys today, I deal with the exact same things. I'm working with these same clients day in and day out. And just because I'm a professional doesn't mean that I don't struggle with these same things. A lot of the things that I may mention are the same things I have to tell myself and I have to deal with, because I also struggle with the fact that the people that I work with don't always do well. And if you look at the statistics, the populations, again, that we work with have the worst outcomes. Sometimes I wonder what's wrong with me that I choose to work in this field with, I choose to work in a field where people are gonna lie to me on a daily basis. They have the highest, I guess this is another thing I was gonna say, the word success. I heard somebody say success before. I think it's all relative, because what I can tell you from what I've also seen is I have seen many of the clients in drug court that have not completed the program and went to prison. They've came back into our agency, and I've worked with some of them again. And I can tell you that seeds were planted, you know, especially if they were in the program for a longer period of time. But the majority of them have positive things to say about their experience in drug court, even if they were one of those people that was struggling and fighting with the drug court team and not liking it. When they really look back, those seeds were planted, and a lot of times they are set up better to do well when they get out. Doesn't mean they will, but they've gained some skills, they maybe have gained some relationships. I know for some of them, they've been able to connect with you again as a mentor or things like that when you guys have been willing to do that. And that's important, because as they went to prison and came back out, now they have to deal with the shame and all the consequences of going to prison. So the fact that some of you have been willing to kind of take them back on, even after you might not have felt very good about how things ended, is important as well. So you guys do make a huge difference, even if sometimes you don't feel like it. And that success, like I said, it is in a lot of different ways. It might be just those little things, but they all build on each other over time. So a couple things just to mention. Since I do work for a substance abuse agency, I just wanted to briefly say, you know, some of us might be working with some of the same clients, so I can't respond if you bring up anything about any particular client situations because of federal confidentiality. One thing to let you know is that we do have a release of information at our agency that if the client is involved with circles of support or mentoring, they can choose to sign, which would allow us to be able to talk with you. So if any of you are interested in being involved, we do what we call family sessions, but family means whatever they want that to mean. And so if you want to be involved in their treatment process or come in for a session with them and the client is open to that, that's something that we strongly encourage. So you would just need to talk with the person that you're working with. You're also welcome to always call our agency just as a resource. If you have questions about, you know, addiction, how to handle a situation, I will give you one of our basic brochures that has our agency information. And so, I mean, we take calls from community members all the time, so feel free. You can contact me personally or just anybody at our agency if you have follow-up questions after today or just situations that might arise. Even if you are working with somebody, while if there's not a release, we can't necessarily give you specific information, we can respond in general to whatever situation you present to us. And so sometimes that might be helpful as well. So what I think is important is to understand what is addiction. When we're dealing with these people, the one thing that helps me the most when people, quote, fail, is to understand what is addiction. Because there's a lot of things that happen, and addiction is a very complicated disorder. So I want you guys to just take a very short couple of minutes and discuss in like small groups at your tables, if you were to come up with a definition of addiction, what would that be? So I'm going to give you just like 2 minutes to do that, and then we'll kind of come back and take a few ideas and then talk about what the research shows as far as that goes. Maybe we'll kind of start over on this side. Anybody want to jump in with kind of what the discussion was at your tables? What you guys came up with?
Well, I guess we talked about this. By the way, I have 17 plus 3 years in Alcoholics Anonymous. So I understand where a lot of these people are coming from. Now, unfortunately, I guess fortunately for me, I never really had a drug problem. What I can tell you about my experience, as you were talking about, I had 3 mentees, Chris and Joel and Dan, all under the age of 35, and they are no longer with us. And I worked with each one of these guys. And so I keep in the forefront of my mind that I can't change anybody. I can do what I'm asked to do, I can serve where I can serve, but ultimately the decision is theirs. So it's the addiction part of this disease is powerful, and it affects us spiritually, emotionally, intellectually, and physically. And it's that part of our brain that says, I can't wait to get more. And it just takes us over. So once somebody has made the decision that they want to change their life, and it's their decision, then it works in the reverse order. So you start feeling better physically. Then you start thinking a little bit clearer. Then you become a little bit more emotionally stable. And finally, those that are successful in AA or in drug court or in any of the programs, the relationship with God is reestablished. And that's the bottom line. It has to be that relationship, that commitment to a power greater than ourselves. You know, and I choose to call that God. In fact, to take it a step further, it is Jesus Christ. You know? And the one thing I can tell you about people that are involved with addiction and get into a lot of recovery, when we first come into it, it's all about us. I got to stay sober. When I get up in the morning, that's the first thought in my mind. Before I hit the pillow at night, I thank God that I was able to do that. But because it's a spiritual program, it leads us to quit thinking about ourselves and start thinking about those that need help.
So Tim did a great job. What do you guys have to add to that, maybe with other thoughts besides the things that he covered so far?
I guess the thing at our table was that we talked about an addiction being an uncontrollable urge, and it was also brought up that this uncontrollable urge was a result of some pain in their life that they're trying to overcome.
What else? We'll start back here.
By the grace of God, I feel led to attend the Narcotics Anonymous meeting every Saturday night, which I'll be doing again tonight. And one of the things that I learned there is that they have a tendency to isolate themselves before they get to what they call clean. And I hear people say again and again, I thought I was happy on drugs and so forth, but I didn't know what happiness was until I got clean. I just love those kind of testimonies.
Go ahead.
It's chronic, and it's a form of enslavement, and it isn't something they can get over. It's something you learn to live with.
So you guys are touching, basically everything you guys have said is kind of the all-encompassing part of the message that I wanted to get to you. And we could talk about what is addiction for hours and hours and hours. And so when Bill asked me to do this, I was like, you're gonna have to be kind of specific of what you want me to cover, because I could talk to you guys. I do 9 hours a week of group, so I talk about addiction and recovery for 9 hours a week, well, and then 40 hours a week, and sometimes probably outside of that. So, but what I wanted to kind of review is really, and remind you of, is what is addiction. You guys covered the main points of that. I gave you a handout that you can take with you. This is from the NIDA, and so it's all research-based. But it pretty well summarizes kind of the basis of what is addiction, and it also talks about what happens in the brain. Now, I am not a neurobiologist, so I am not the greatest at explaining brain science. But for me, one of the best ways to help me when I struggle with clients that are struggling is to remind myself what is addiction and how does it change the brain. Because some of you mentioned, you know, that involuntary part of it. What happens when you use drugs, the short version, is that the pleasure center in your brain is activated. The drugs that you use, it's not the drugs themselves. They mimic naturally occurring brain chemicals, neurotransmitters. And so they cause our brain, and depending on the drug, they're all slightly different. But they cause our brain to release those different types of neurotransmitters. And so our brain adapts to that. It handles more and more. And so then obviously that's also what causes the physical withdrawals when you initially stop use, is because your brain learns to tolerate more and more. When you take that away, those physical withdrawal symptoms start. So it's physical. Now what also happens is if you look at actual brain scans of substance users, you will see that that pleasure center is what lights up. And for a lot of people, the frontal lobe is the part of our brain that has to do with reason and higher thinking skills, logical thinking. And so a lot of times, because that pleasure center is lit up and that's so intense, that part of the brain does not function. There are certain drugs that if you look at brain scans, literally the only part of the brain that's lit up is the pleasure center and the back part of the brain that tells you to breathe. With drugs like meth and cocaine, that's why they don't eat. The part of the brain that tells you to eat for survival, it doesn't light up anymore. And so that's why people tend to lose a ton of weight, is because of those physical changes in the brain. So now once that happens over long periods of time, and to add to that, keep in mind the fact that many of these people start using substances when they're anywhere from, in some cases as early as 9 years old, but 13, 14 at a minimum, their brains haven't developed those emotional reasoning skills and those logical thinking skills. And essentially, a lot of times they are trapped emotionally. If they start using at that age and then continue with that, they often will be stuck at that developmental level. I don't care if they're 40 years old. They may be emotionally and with their logical thinking skills at 13, 14. And we see examples of this in their behaviors. And so while they're learning how to live a life in recovery, they're also learning some of those same skills that those that haven't dealt with addiction started to learn when they were 14, 15, 18, all those types of things. So that's important to keep in mind as well. So, if your clients that you're working with start throwing a fit or slam the door or hang up on the phone on you, that's a 13-year-old reaction. That's how their brains react. So when they're faced with those situations where drugs might be there, that logical part of the thinking isn't always kick in. Again, it's that emotional part. And even when they aren't using, they show even just seeing drugs or experiencing what we call triggers, persons, places, events that bring about the thought of using, that part of the brain will light up, even without the substance. It's priming the pump, as they call it. So that can continue for very, very long periods of time, and even with people with several years in recovery can still experience those triggers. And so what we try to do in treatment is to get them to learn a different way of thinking and to challenge their thinking and to really, in a sense, get their frontal lobe to do push-ups and practice, because when they're so used to acting on the emotions, we try to bring them back to the logical part. And this might be also what some of you do in your circles of support and talking through things with them. And that's one of my biggest suggestions to people is when you're dealing with people, try to bring it back to logic and get them to look at things logically. We talk about playing the tape all the way through. A lot of times if somebody brings about a situation that they're struggling with, try to help them see the bigger picture. Okay, so if you were to go use, what might happen next? If you were to choose to break this rule, what might be the consequences? And then even on a bigger scale, how might that affect things? Many times, especially early on, they don't have that ability to see that. And so again, for me, I go back to this when I see people struggling and relapsing, is it is related to their brain. Addiction is a disease. It's chronic, meaning it continues. It's relapsing. They may have relapses with that. It's progressive and it can be fatal. So it meets all the criteria as a disease. Our medical community identifies substance abuse as a disease. And so the best way to think about it a lot of times is cancer or diabetes. Somebody who has diabetes, they're probably always going to have it, but they have to learn to manage it. And it may or may not cause problems for them in their life depending on how well they're managing it, based on the lifestyle changes that they make. So if somebody has a flare-up with their diabetes and their blood sugars go through the roof, how are you going to feel? Are you going to get mad at them because they have a flare-up in their blood, with their blood sugar? Are you going to, not talk to them anymore because they have a flare-up in their blood sugar? And this is one of those things that, as a society, we still have a lot of work to do to understanding addiction and how we treat that. And there is that movement to try to move from the criminal justice approach to more of a treatment approach. When you recognize it as a disease, we need to treat it like a disease. So when people have relapses, it doesn't mean that they are failing. It means that their treatment plan or their recovery plan needs to be adjusted. We generally as an agency, we're not going to kick somebody out of treatment because they relapse. We're going to review their treatment plan and say, do you maybe need a higher level of care? Is there a part of your life that you have been neglecting that you need to take a look at? Those types of things. And so it's something I think for me that's helpful is to remind myself not to necessarily get angry or disappointed, but to keep that in mind. How would you treat a diabetic who's having a flare-up, or somebody who has cancer that all of a sudden has a recurrence? Are you going to get upset with them? Are you going to get angry with them? Or are you going to try to help them? And so, now that doesn't also mean that you don't need to set boundaries for yourself. And that's another thing with that, but we also need to maintain personal boundaries in our personal self-care. And Lynn's going to talk more a little bit later about how we do those things with self-care. So, Tim did a really good job of identifying all the areas that addiction affects. Biologically, psychologically, socially, spiritually. And this really ties into kind of the next part, which is what is recovery. And so Tim really actually gave a great introduction to kind of what is recovery. It's building those things. And just like he said, the first part is getting over the biological part, the physical part. And it is also important to understand that they say research-wise that it can take people's brains up to 2 years of abstinence before they really fully heal, and some of their organs as well. The great news is that our bodies are extremely resilient, with the exception of like certain types of liver disease that can't be reversed if you get to a certain point. Most of the time, the damage that's done can be reversed to an extent as long as you start making healthy choices. And so the biological part, to be honest, is fairly easy to get over. You have those withdrawal symptoms, you feel really bad, but then it's done. The biggest challenge then is the mental part, as we talked about, those learning to change your thinking. And our thinking didn't get that way overnight. So we can't expect that 2 months into recovery, when I've been in a lifestyle of addiction for 15 to 20 years, that my thinking is going to be completely different. So that's going to take a lot of practice, and oftentimes the way that thinking changes is by making the mistake and then analyzing it. Sometimes you'll hear us talk about doing thinking reports. That's kind of what we're doing. Hopefully over time, then we're also teaching them skills to be aware of themselves emotionally, so they can intervene at the emotional point, or also even just eventually at that first thought. There's a comedian, if you're ever interested, his name is Mark Lundholm. He has some stuff on YouTube you can look up, but he's in recovery. And he uses a phrase that I say to clients, and a lot of them catch on to, it's first thought wrong. And he says sometimes second thought wrong, third thought wrong, fourth thought wrong. But that's what he says to himself all the time. As an addict in recovery, chances are the first thought that pops in his head is always going to be wrong. And so he has to learn to challenge that thought. And that's really what we're trying to get people to learn to do. So something that I always will sometimes say to other people who struggle to understand addiction is that expecting an addict to make logical decisions is illogical. Because once you understand how addiction works in the brain, they really can't. And I'm not taking away personal responsibility. This is where it gets hard, because it's not that they can't whatsoever. But when you look at it on a biochemical basis, that part of the brain's not firing. And so, again, it takes practice, and over time, yes, they may be able to fight that, but there are times where that part of the brain just doesn't work and tell us to do the right thing. And so again, for me, this is what really helps me, is to bring it back to the biology when I'm struggling with why do people make the choices that they make, and especially with the consequences they have. Another tip that I always like to add that helps me is to understand that just because somebody has a relapse or a slip does not mean that every single thing they said up to that point or did up to that point, they were lying. A lot of times that's our first thought is, well, they must have just, I met with them yesterday and they were telling me how motivated they were and how much they wanted to keep moving forward. In that moment when they told you that, they were probably telling you the truth. It takes that long to make that wrong choice. Sometimes, if it is one of those situations that they haven't put themselves in, or it was unexpected, whichever way, it can be a split second. It can also be over a process of a couple months that a relapse happens. Oftentimes, relapses do happen as an accumulation of multiple things, and there are a lot of warning signs, and that's something that we try to get to work with them on to understand. And if you want to try to help them with that, all clients have a relapse prevention plan or a recovery plan or something along those lines. Ask them, if that's something you're interested in, if you have that relationship, ask them if they'll share it with you. Because by them sharing it with you, you might be able to help them to point out some of the signs that they've identified themselves as those things. We encourage them to do that. They actually have spaces on their relapse prevention plan to have other people sign off. I don't require them to do that, but I strongly encourage them to do that. So that's one way that you can try to help them too, is to be brought into that, but also to understand at the end of the day that you are not responsible for their recovery. And that's the important part. They are the ones that are responsible for their own recovery. You may be able to help them, but they make their own choices. And the other thing, which is a social work value that's brought in, that I also remind myself of often, is people have the right to self-determination and self-destruction if that's what they so choose. And so that's hard to accept when we really start to care about people. We want to see them well, and if we've invested a lot of time and energy into seeing them doing well. But at the end of the day, they have the right to choose what they want for their own life. That's not a reflection on me. That's their own independent choices. So we start to see how all these different things kind of play against each other to make it really difficult for people. As I said before, Tim mentioned some really great stuff as far as recovery, so I'm not gonna go into that, but I am gonna just have you guys pass around a pamphlet that's from SAMHSA, and it talks about their working definition of recovery, and that's for substance abuse and mental health. Most of the people that we're working with have both. If they didn't have a mental health disorder before they started using, they probably do afterwards because of the consequences of their addiction. And so they have to manage both of those together, and sometimes that makes it really, really difficult for them. But it just has some really good basic understanding and tips of kind of what makes a good recovery program. So I'm not gonna go into depth with that, but I'm just gonna send you away with that if you wanna reflect back on it. But it gives some good ideas about what recovery is, and what you'll really see, and this is one thing that's kind of changed in recent years as far as how we look at things, is that recovery is very personal. In the past, a lot of things were, this is recovery. You must do this, 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 and this in order to be considered in recovery. And what we've been told a lot more in our training as substance abuse professionals is that a person's in recovery when they say they're in recovery. So it's not what I want for them for their recovery plan, but it's what they feel for themselves as their recovery plan. Now, for some individuals, and this can be hard to accept, but for some individuals, that might mean abstinence from all substances. For some individuals, they may choose, and while we don't recommend this, they may choose, if they haven't had a problem with alcohol in the past, that they may drink on occasion, but continue to not use drugs. Now, again, it's not something we recommend, but again, that's their choice. And so I have to learn to respect that, and also I will continue to challenge them. I'll explore all the risks of that with them. I'll check in with them on how's that going for you, those kind of things. But we have to kind of look at, if they feel like they're in recovery, then they may be. Now, having those relapses doesn't mean somebody's not in recovery. That's often part of the process, as we said. Now, it doesn't mean that, I also always try to say this to clients, relapse may be, I like to say that relapse is part of addiction, not that relapse is part of recovery. Because really, you're taking a step away from your recovery and returning into your addiction. But it is important to understand that it may happen for many individuals. And many of them that are coming into these programs have probably had many relapses or tried to quit using in the past. And so it may continue to happen, but it doesn't have to, and not everybody will. Some people get it on the first time, some people it takes the 20th time before they get it. I've been working with one particular client that I first met them when they were 18, and I think they're 24 years old right now, and they're still in treatment, kind of still in the same place. Now, it's been great because I've gotten to see how much that person has grown, but in the bigger picture, it's like you're still in the same place that you were 5 years ago. Still involved with the criminal justice system, those kind of things. But, I have that internal gut feeling that they're getting much closer to getting it. And so, I guess just going back to this, the other thing that's kind of included in this recovery pamphlet is the idea of lifestyle balance. Trying to find the right balance between home, family life, social life, spiritual, physical, mental, work, financial, figuring out how you put all those pieces of the pie together that works for them. And this is the same thing I would give you when you're working with these individuals, is to challenge yourself of how am I balancing my life? And how am I keeping all those pieces of the pie together? Am I spending too much time on one part of this? Am I spending too much time mentoring and helping people that I'm neglecting my own personal life? Because that's when you're gonna start to struggle, is that same thing. And that's when we see that relapses happen for clients, is if they are having too many of those areas of their life get out of whack, that's when relapses are more likely to happen. If I start having a lot of health problems and a lot of stress in my life, I'm higher risk for relapse. And the same thing for all of you just emotionally. If I start spending too much time on work and not enough time at home, then I'm gonna be at a higher risk for stress and burnout and things like that. Some other resources that I want to make you aware of, some of you may have heard about Al-Anon, and that is a resource that would be open to all of you if you would ever be interested. Al-Anon is kind of a companion to Alcoholics Anonymous, or AA. Al-Anon is meant for loved ones of people who have alcoholism. There are also groups in Dubuque, I believe there's at least one NAR-Anon meeting, there's also Families Anonymous. I did bring some pamphlets for the Dubuque area Al-Anon meetings. You can find all those also online if you look. I didn't necessarily bring enough for everybody, but I have those for any of you who might be interested or at least just want to have that on hand if you're ever thinking about it. But the three main components of Al-Anon that they focus on are the 3 C's. You didn't cause it, it's not your fault. You can't cure it. Again, we talked about the addiction side and it being a disease, and we can't control it. That idea of powerlessness. And so those are also helpful to remind ourselves of as those 3 C's. You know, I didn't cause it, I can't control it, and I didn't cure it. One of my other most helpful things I have in big letters stuck on my wall with vinyls, the Serenity Prayer. So say the Serenity Prayer to yourself often and ask yourself, you know, do I have control over that this happened with this person? No. The answer is always going to be no. What do you have control over? You have control over how you deal with it emotionally, and you have control over how you help the person and how you respond to what's happened in their life. And so that's the part that you can focus on, is how do I deal with it myself emotionally, and how do I then respond to the person. So Al-Anon can be a good resource, even if you're not in that relationship. The relationships that you guys have as mentors and circle members is the same thing. So Al-Anon is an appropriate place if you choose to get support. I'm not saying that you all need to go, but it also is a good idea to even just go to check it out, because it gives you a similar format or structure of what the people you're working with are probably going to if you haven't been. They also have open Narcotics Anonymous or Alcoholics Anonymous meetings. So if usually if you look at a schedule, they're designated with like an O or a C. Open means anybody is welcome to go, where C means closed. Only somebody who identifies as alcoholic or addict is welcome. And so it might be a good idea to just go with sometime to a meeting with somebody that you care about, just to see what it's about and get an idea. Another cool thing is, at least here in Dubuque, some of the Al-Anon meetings are scheduled the same time as the AA meetings, like specifically Mercy's one location, I know that does that. So you can actually go with the person and just split. They go to their AA meeting, you can go to the Al-Anon meeting. And so that's a really great resource that's there to try that out. Otherwise, there's also even online meetings. Now that's not, it's a resource if you were to need that or you have those things. I always suggest doing things in person, but as a backup, that's something that's out there. They're usually 24 hours a day if you look and find them. So I guess I mentioned before kind of the trust issues, and so I think that's, if I could leave you with some things to keep in mind as you're working with these people, is one, to understand that for many of them it's hard to build that trust. And so if you do get that trust, value that, because for a lot of them that's very, very hard, and that's something that we work on with individuals a lot. The other thing that I feel like you guys have a really great, unique perspective, specifically to drug court, but to any of you that are dealing with other criminal justice involved people, is you get to be there completely independent of all the rest of it. We all get looped in. I'm not the criminal justice system, but some of my clients just assume so. And being part of drug court, I am still part of the drug court team, and that puts me in a rough position, because I still have to, I do what I can to advocate for clients when we have our drug court staffings with the team, but at the end of the day, I also have to hold them accountable. Where I might want to just listen impartially, I still have to hold them accountable. And so you guys have the great thing that you can just listen. You can just be their ear. You don't have to, you're not going to sanction them. You're not going to, you don't have to judge them. You don't have to do any of that. And so I think keep that part of mind, that you get to be completely impartial to all of that. Also, and sometimes it's important to understand that if people struggle, maybe you need to kind of let them go. If they go into like a full relapse where they're just out there using, and you can see the mental backslide as well, sometimes you might need to pull yourself away for a while, just for your own sanity, to take care of yourself. Now, then you have to decide your own boundaries. Maybe you will allow them back, at some point, if they decide that they want to get back on track and they come to you for help, or ask you to, help support them, then maybe, again, you can be there and try to be non-judgmental, but start to learn where your own boundaries are between, if somebody's in active addiction versus, and this is a hard line to know the difference, but for me, it's pay attention to their mental attitude. You know, if they slipped and they used one time and they're talking about it and they're being open with everybody and they're asking for help and they're really trying to do the right things, it might have just been those really short slips. Other times that use sparks off a whole series of backslides. They slide right back into the old behavior, and that might be a time where you need to step back. Because if you are actively there, they're probably gonna try to use you, and they're probably gonna try to pull you into their drama, and then it's gonna be really hard for you to stay healthy. So sometimes you need to have that healthy separation, but then I think there's also a point that they may all of a sudden have that wake up moment, that aha moment, and they might come back to you for help, and then I think you have to decide, one, if you are prepared and willing to do that, but sometimes you can be that great spark too, to get them where they need to go. The other piece of advice I would also offer is know when whatever they're talking with you about expands your personal level. You know, sometimes when clients learn to trust, unfortunately, they share the wrong things with the wrong people. And I have to try to work with them a lot. You know, they might decide to share their life story and their past history of abuse with their mentor. You might feel very overwhelmed by that. I mean, you should be grateful that they trusted you enough with that information. But if you don't have that background knowledge to know how to respond to that, that might make you feel very uncomfortable. And so there's a point that it's not your responsibility to work through every issue with them. It's okay for you to say, you know, let me help you find a resource that can help you deal with this. Even I have to do that in my job. There's sometimes where there's certain issues that, you know, I can't be an expert in everything. But if a client brings an issue to me, I'll say, you know, I appreciate you sharing this with me. Let me help you get to the right person. And so recognize where your own line is there with that and seek out help either for yourself or for them if you need to, in order to not have to take on some of that. Because again, it's awesome to hear some of their stories and they're very interesting, but they're also sometimes very traumatic, you know, to hear what some of these people have been through. I'm not sure how we're doing with time. Okay, so what I'm thinking is I want to make sure that we give Lynn plenty of time to talk with you. If you guys have questions that are coming up about addiction in general or follow up to some of the things that we've been talking about, I would welcome you to let Bill know, and if he wants to like send me a list of questions, I can make sure to get him like answers to those specifically, because like I said, when we talk about the topic of addiction and recovery, we could talk about that for hours and hours. And there's tons of great resources out there as far as information. One that's really simple, if you're just looking for, there's actually a lot of different topics on there, it's drugfreeinfo.org is the website. And they have just a lot of different stuff about different types of drugs. If you want to learn about a specific drug, they have information about recovery. And it will connect you with all reputable resources and stuff. There's a ton of stuff. If you just Google a drug online, you're going to get a wide variety of surprises. But sometimes that's actually a good thing too, because it's good to understand both the professional viewpoint on things and the actual user's viewpoint on things. So with that, I'm going to kind of close things up. Is there any specific questions to the things that I've talked about right now? Otherwise, like I said, feel free if you're coming up with some to jot them down and give them to Bill, and I would be more than happy to like give him resources or answers to those specific questions. I'll also just pass around, as I said, our flyers from SASC. If you're ever interested, you can contact us directly for some more information. And then I also have the brochures for Al-Anon. If any of you would like to take those with you, feel free.
I do have a question.
Yeah.
I know that SASC for the drug court thing, maybe you can outline this for me. If the person is in drug court, they have to go to, I think, there's various stages and so forth that they have to do. Is a lot of it intellectual, or what should get them to understand? Is that what SASC does? Could you tell me just
What
briefly
treatment
what
is?
the program, what the treatment is from SASC as part of the drug court?
Sure. And to be honest, the treatment that they go through is very similar to the treatment that we have for all clients.
Okay.
It's really not too different, other than our requirements for frequency of attendance is a little bit more intense because it's an intense program. There are different levels of care. Unfortunately, in Dubuque, we don't have residential substance abuse treatment, so if we determine that a client needs that, we have to refer out to another program. But most clients in drug court always start at what is considered intensive outpatient, and that just has to do with the frequency. Intensive outpatient means 9 or more hours of treatment a week.
So they come and meet with you for 9 hours, and Are
They
they
do.
like 3-hour segments,
Yep.
3 days a
They
week?
do, yep, 3-hour groups, 3 times a week, plus if they're in drug court, typically an individual session once a week as well. They may or may not be given some homework assignments, it kind of depends. What we work on is, again, a huge variety of topics. It's basics of what is addiction. On the same token, a lot of the clients that we work with in intensive outpatient have been through treatment before. So it's kind of a mix of therapy of what's happening in your life and how can we help you deal with that. You know, the group members are encouraged to give each other feedback, to hold each other accountable. My job really isn't to be an expert. It's not really educational, it's therapeutic. So my job is to facilitate the group and keep the group going and connect group members to group members. Now, we have both a day and an evening programming, and I mean, there's some specifics about what they can do with that. But, so they start with that, and then they move down to what's considered extended outpatient, and that means less than 9 hours of treatment a week. So that could be a combination of 1-2 groups a week, typically still individual sessions, and eventually they move into continuing care services, and continuing care is an hour once a week, and then individuals as scheduled.
And they work with the same group of people with a mentor or facilitator like yourself? Is that what they do? Like, would be 10 people get together, or?
Generally, I mean, and our group numbers change. The way we do it now is it's open. We've done it a couple different ways. At one point in time, I had a drug court only group, but kind of we had times where our numbers would get small and that was hard to maintain. And then right now, it's actually integrated. So they're with other clients that are just in the same level of care at our agency, which sometimes I think is good, because it doesn't allow them to make it all about, let's complain about drug court and why I don't like my PO today. But yeah, and they might be with the same group of people. They also may change, like, you know, especially once they move to different levels of care. We have specific groups. I mean, we have like a step-down group that's built in, so they get to stay and kind of become like a senior peer after they've completed the primary part. We have like a wellness group that deals with combined mental health and substance abuse. We have a women's group. We have a criminal thinking group. So we kind of disperse them where we feel is most appropriate for them after that.
Thank you very much.
Yeah, you're welcome. Sure.
Thank you for all the tips. I probably don't want to quit anymore. But there's one little thing. If you could talk to the judge about the microphone system in drug court, I'll be glad to donate a wide area mic that we cannot hear. The judge we can hear because he's facing us, but the clients we can't.
And I know we've talked about it a lot. I can try to remind him about that. You know, I think from his perspective, he's just focused on making sure he does his part, but I will remind him, because I know you guys do put time and energy into coming, and I know the couple of times I've sat in the back, it is hard to hear, so.
Thank you, Bobbi-Jo.
Yep.